one person who's here ready to go, Dr. Kurt Ewen. He's our Vice Chancellor of Strategy, Planning, and Institutional Effectiveness, also the Chancellor's Chief of Staff. Good morning to you, Dr. Ewen. How are you on this Tuesday?
I'm well, Todd. Sorry, I had to unmute. I'm doing well. It's good to see you.
It's good to see you. You know, a lot of things, things just keep changing in this pandemic. Here we are once again facing some COVID variants that have really kind of gripped the whole city, made us all uneasy. And I understand it's affected our operations once again. You're the head of the COVID task force. Maybe you can tell us some of the changes that the Chancellor announced last evening.
Sure. We watched the data coming out of Harris County, Fort Bend County pretty regularly. And we've been noticing, as many people have been on the news and other places, the impact of the Delta variant. We have about 50% plus of just over 50% of our population vaccinated. And still our numbers now in terms of infection rates per 100 residents is higher than it has ever been during COVID. And we went back to red, and we've actually created a new classification of red worsening. So we are in a red worsening condition, as we would describe it, which means that we need to take some continued extraordinary measures as we move into fall. The memo that went out from the Chancellor last night is the byproduct of a weekend worth of work of about 50 people collaborating on putting some things together, our best thinking that we could give to the Chancellor about how to move forward.
So what are some of the changes? From what I could tell, it looks like a number of courses, predominantly the majority of classes, are now going to be online for at least 4 weeks. Is that correct?
Yes. So what we're doing is we're going to be monitoring this. Every 2 weeks, we'll be coming out with a new announcement as to what we're seeing going forward and what we think the realistic possibilities are. As of now, what we're announcing is that effective Monday, the vast majority of in-person classes will be switched to online on a schedule in the same way that we did last spring and throughout the year. The courses that are not included in that are the kinds of workforce courses that require hands-on engagement, automotive, healthcare, all of those kinds of things. Todd, those programs have been face-to-face in their labs since last June.
Yeah.
They have tracked this all the way through the pandemic, and we have had next to no evidence of transmission through those encounters. People have the PPE, they go through the screening protocols, that kind of thing. If a student is unclear, they should reach out to their faculty member. We're working on a clearinghouse opportunity so the students can go directly to it to find out if their class has been impacted. They should probably err on the side of if it's an English class, if it's a science class, a history class, it is online on a schedule for the first 4 weeks. Second thing, we are going to go to screening protocols like we did before. Everybody will get if you're coming onto campus, go into your phone, you get your screening app, you answer the questions, you get a green bar, and it allows you to come in, and you'll get a wristband. They won't be at every door. They'll be at centralized locations at every campus, so that we can keep everybody safe. Yeah.
I know, Dr. Ewen, over this past weekend, we did cancel some in-person registration events.
Yes.
Student services, a lot of students are wondering now if they are wanting to sign up, register, speak with an advisor. Are you suggesting now they go use the virtual lobby like we've used over the last year, as opposed to going to a campus for student services?
We find the virtual lobby is part of what we're considering our next normal. It is a very popular option, and we're looking at ways to scale that centrally across the system in a way that's as consistent as possible. We are relying on the Zoom lobbies once again this fall. Most campus locations will continue to be open for some kinds of service for the students who need it. Some places can't. Central College, for example, has been overwhelmingly hit, and the vast majority of their staff is now out on quarantine. Wow. And so students who are interested in coming to campus to get that kind of support should check online to see what services are available. If they need instructional or advising support, and they were going to Central, they can go to Southeast and go to other locations. The advising will be the same, but they're not going to be able to see people face to face at Central right now.
So some takeaways are right now, just to keep it basic. First 4 weeks from majority of courses are going to be online on a schedule. Mm-hmm. If you are needing student services, you're suggesting use the virtual lobby. Some campuses are very limited with student services, but the virtual lobby would be the first thing. And you will be updating the students, or the Chancellor's Office and administration will be updating the students, faculty, and staff on a every 2 week basis, correct?
As to what we foresee in the next couple of weeks, yes.
Okay.
In terms of how we want to promote this, the governor has made it clear we can't require masks in our buildings. We can't ask if you're vaccinated or expect you to get vaccinated, but we're encouraging people to take the pledge with me. Get vaccinated, wear a mask at college, and when you're out at HEB or other places, wear a mask. Keep your distance. Wash your hands, all those things that you really need to do. Take that pledge. If you do, as a student, you're going to get some things, some opportunities. As staff, you're going to get other opportunities in terms of ways of advertising the fact that you've taken the pledge. We're also going to be having Swoop walk around with his newly minted mask, handing out trinkets to students who are wearing their masks in the building as a way of saying, thank you, you're in this with us. Here's a t-shirt. Here's a soar-safe HCC mask that you can wear. Those kinds of things, yeah.
Dr. Ewen is talking about the HCC soar-safe pledge, and it was in the Chancellor's email. And the five things are: wear a mask, wash your hands, watch your distance, stay home if you're sick. Very important.
Yes, there you go. I forgot that one.
Stay home, and of course, get vaccinated. We're asking that you do that. And if you take the pledge, there's also some incentives as well for the faculty and staff, correct?
Correct, yes.
Okay, and you can sign up through the email that was sent out yesterday. Dr. Ewen, it's got to, and I've seen this in the news continuously over the last 2 weeks, it's got to be challenging for school districts, public universities, and community colleges like us when your hands are tied in many ways with wanting people to wear masks, and you've got orders against mask mandates. It's got to make it tricky to navigate the things you guys are doing to try to keep all of us safe.
It is. I don't know which political trapdoor you want me to walk into there, Todd, but I do think it is tricky. We're trying to navigate this and say, you're not required, but take the pledge with us.
Right.
Recognize the fact that if you're safe and your practice, you'll help keep me safe, my family safe, and in turn, I'll do the same for you. And I want to make a comment on it. If you're sick doesn't mean you have a doctor's note. If you're not feeling well, take that as a sign. If you're not feeling well, don't come to campus, right?
Absolutely. And once again, we're all doing this just to keep everyone safe. That's the main thing.
That's right.
And
That's
Dr.
right.
Ewen, I imagine the more we try to stay safe, follow what we can, the sooner we can get back to some type of normalcy, whatever that's going to look like. And we haven't reached that point yet. It seems like new things are happening every few weeks.
It certainly is an ongoing opportunity and leadership possibilities. I do want to make a comment to our staff. I know that this is a challenge. We're working really hard to make the best decisions we can. We don't want to make the decisions too far out and cancel plans that we have. So we're trying to do this as timely as we can. We're aware that it's stressful. We're aware that everybody is just weary from a year and a half of this. If we all work together, I will tell you that the work that we did this weekend, I have never seen the 50 people that I work with regularly in as much of a team mode as they were this weekend. Rely on each other. Call your colleagues around college. Ask them how they're doing. Be a friend, be a neighbor, be a colleague, and we'll get through this together.
Dr. Kurt Ewen, HCC Vice Chancellor of Strategy, Planning, and Institutional Effectiveness, also the Chief of Staff. We appreciate you being here. We appreciate all the work you and the task force is doing. Stay safe, and we hope to see you in person soon.
Wash your hands, Todd.
I will do. All right. Thanks, Dr. Ewen. We'll talk to you soon. Okay, big changes on the way. As you heard, of course, we'll be mentioning that a lot here on Up to the Minute throughout the week and as we go into the next few weeks. So make sure you stay tuned to us.